People don't take skin health seriously because they don't think there are any serious consequences of a skin disease.
No, I don't stay away from doctors for any other thing.
If they have other things like heart disease or kidney disease or pain from their arthritis, from a number of different causes, this is something that doesn't bother them.
We don't see the skin as an organ. We kind of see it as this thing that covers up all the other stuff. Sometimes they look almost like a psoriasis type of thing, dry skin. And you can kind of blow it off like, oh, it's just dry skin.
If you don't touch it, then you don't have to do anything about it, and then you kind of hide it under the rug.
Kind of like, out of mind, out of sight.
There's an element of denial which overrides everything.
And they think that if they just ignore it, the problem may go away, which of course is not true.
I kept saying, this is a cold sore, it's going to go away, and it didn't,
There are challenges to chemotherapy, treatment for not only basal cell carcinoma, but for any carcinoma.
The choices are very limited.
Anytime you tell a patient that they're going to have a scar, especially on a visible area such as the face, they're always very concerned.
I thought that I was going to lose part of my lip. That's what I kept thinking. That, how sometimes they have those little kids born with that lip? Well, that's what I kept thinking was going to happen here.
So the unmet need at this time, in my opinion, for patients with advanced basal cell carcinoma is to come up with a non-invasive modality which will provide the highest possible cure rate. There are patients who are out there who are not amenable to surgery or radiation.
This is a tool that can be used for patients who don't have any other choices. That's a big strength.
When people hear that it is not chemotherapy, they are jubilant.
It gives you hope, hope.
Hope is of critical importance. If a patient who has cancer does not have hope, they don't have anything.